Hi, my name is Paula Gutierrez. I'm the Director of Diversity and Inclusion and Director of the Siperstein Proud Center at RWJUH Somerset. In my role as the Director of the Proud Center, I oversee the day-to-day operations of the Proud Center. The Proud Center is New Jersey's first LGBTQ healthcare facility in the state of New Jersey, aligned with the major healthcare system.
My name is Danielle King. I am the coordinator / LGBT patient navigator. So a big part of what I do is help guide patients through the system. With each patient, I have a one-on-one meeting. I find out what are their support systems, what are the things they need, if they're having any issues outside of even the healthcare system.
I also oversee our business resource groups, and those are groups of employees that come together on a shared characteristic, quality, or life experience.
Within LGBTQIA is also allies. So we do ask our other staff who are not LGBT to also attend so that they can be a part of the conversation and we can help make the hospital more comfortable for everybody.
So the Proud Center opened its doors in January of 2017. Initially, it was embedded into our family practice, which is a much larger practice within the hospital. And we were there one night a week on Monday evenings from 6 to 9. But very quickly, the volume and the need for these services continued to increase. In 2019, we actually moved the office to its own office. It's across the hall from the family practice, which is the original setting, but now it's in its own office with 4 exam rooms, and we have full-time staff. So now we're open Monday through Friday with evening hours on Tuesday. So we've grown tremendously in the last 2.5 years.
A big part of what I do is doing cold calls to people throughout the state. So a whole lot of different resources because I want to make sure that all of our patients are getting gender-affirming care. If I encounter a facility that doesn't understand the lingo, but I get a sense of that they want to learn more education, I will go out there, usually with the physician liaisons through RWJ, and we do training. So we'll do like luncheon, hold a whole entire presentation.
Some of the services that we offer include hormone replacement therapy for transgender patients. We offer PrEP, which is pre-exposure prophylaxis for those that may be at high risk for HIV. But we do also offer primary care for the entire LGBTQ community. So preventative visits, pap smears, vaccines, etc. We do it all.
The type of work that we do, it's not just in the office, it's also in the community because we're trying to make the community safer for everyone. So whether you're a patient with us or you're not, we want to make sure that even different facilities that are out there do understand this type of information, which is why we do the work that we do.
So due to COVID-19, a lot of other LGBTQ health centers had to close their doors. We're very fortunate to be part of a very large healthcare system, and within a few days of recognizing that we had to close our doors to patients, we were able to transition to a telehealth model and let them know that the office is still here. While we weren't physically accepting patients in the office, our staff did remain here to ensure that there was a continuity of care. We've recently reopened our doors to patients in the office again. We still are offering telehealth for those that don't want to come in to the practice, but we are taking every single precaution to make sure that not just our patients are safe, but also our staff. When they come into the building, their temperature is taken and they're immediately given a surgical mask. Everything in the room is disinfected prior to the patient coming in and before the patient leaves. Some of the great things that we do, especially during the month of June for Pride Month, which we're in now, is that we do a lot of different celebrations to highlight and recognize Pride Month and what it means, and also again recognizing that our employees really are our most precious resource. So having a diverse staff is something that's very important as part of our organization. We do a flag raising during the month of June to commence Pride Month.
Using pronouns is a great way to show the patient, to show your client that you're gender affirming, and it's also saying that you understand them. And by just asking what are your pronouns, you're giving them the sense of, okay, they're respecting who I am, they want to know who I am, and I can be comfortable with them.
Why do members of the LGBTQ community need their own center? And it's because there has been a lot of systemic and institutional discrimination for members of the community. And they've gone to a healthcare provider that may not have been affirming if they've been transitioning or with their sexual orientation, gender identity. When we start with something as simple as, what are your pronouns, what's your preferred name, that immediately sets the tone for how the rest of their interaction and visit is going to be with us.